372.
Calculation.
Yep. 39.
This is what an emergency department sounds like in the grip of a pandemic.
Can I have a big ghost, please?
The stream of COVID patients is constant.
Background of high blood pressure and high cholesterol.
This man was brought in this morning. His multiple sclerosis has flared up, but doctors fear a sharp spike in his temperature could have been caused by a COVID-19 infection. We're in the Royal Surrey County Hospital's emergency department. This area is exclusively for suspected COVID-19 cases. It's been expanded, but it keeps filling up.
We had doubled our numbers the week just after Christmas, before the end of the year, and we are maintaining that numbers up. So at the moment, we haven't got any feeling that this is going to be to slow down. We are prepared to be like this for the next 4-6 weeks at least.
That is a long way away, a month and a half of unrelenting pressure. To give you a sense of how busy this emergency department is, since midnight, they've admitted 30 patients, 8 of whom are suspected COVID-19 patients. It's only 3:15 in the afternoon. By midnight tonight, that figure is expected to treble. Some of the sickest patients are brought here. This is a purpose-built, high-dependency COVID-19 ward. Having this extra capacity prevents the hospital from being overwhelmed.
And how long has she had symptoms for?
So she tested positive on the 3rd of January, but she came in, she required 4 litres, but has gone on straight onto CPAP, so now she's on CPAP 60-10.
It's relentless, really. The admissions come fast and they come all the time. People are sicker. They're sicker now than they were in the first wave, very much so. Sicker, younger, and of course, once you're sicker, you're going to be in hospital for a long period of time, and then you can't really always predict which way things are going to go. And we're seeing some very tragic situations, of course. And we are seeing patients who did have gatherings over Christmas or New Year's, which were allowed, but we're now seeing the after effects of that. And it brings a lot of guilt and emotion, of course, with it.
Hi, David, how are you?
Not too bad.
Are you holding up?
David is one of these young patients. He's just a teenager.
Yeah, only 19. Yeah, it shows that it can get, like, anyone can get it, like anyone at all. And then, as you can tell by the seriousness, I'm having to be on oxygen. I've been on oxygen since the time I've been here. I haven't had any medical issues, really. And all of a sudden I could be like this in a bed, in a hospital, stricken down, not being able to do anything because of this virus. Like, it's terrible.
Are you worried about how you're going to get better and any long-term effects?
Oh, of course. Like, it goes around my head, like, this could potentially damage my lungs a bit. This could potentially stop me doing stuff that I want to do.
I'm not sure about that.
The peak in hospital admissions is still a week to 10 days away, according to the government. So beds do not stay vacant for long.
Since we've opened, we are very busy. We are going in one patient and one patient back in again, so it's in and out constantly. For us, we're kind of viewing it as, we're almost in a tunnel. We know that there's a light there, we just can't quite see it yet.
And that darkness is being felt across the country, not just for nurses like Elaine, but for youngsters like David too, who'll worry about the impact of COVID-19 on their health for years to come. Ashish, Joshi, Sky News at the Royal Surrey County Hospital.